Good afternoon, teacher. My name is Mauricio Avila. For cycle paramedicine student. The following video is about fracture. Continue. Compound fracture. Definition. Fracture generally occur due to car accident, fight or sport injury. Other causes are bone loss and osteopathic, which cause weakening of the bone. Risk. In the children and the elderly, the bones at major fracture. In these people, fracture is usually more frequent. Compression, compression fracture, a type of breaking of a bone caused by press and by which the bone includes. Compression fracture usually only in the spine and in bones with the cancer of osteoporosis, detected bone mass and density. Risk. Patients with have hand and orthopedic vertical fracture are incremental risks for other vertebral and non-vertebral fracture because of perforated hinge joint. Depression fracture. A skin fracture is considered depression when an portion of the other tail of the fracture is below the inner tape of the bone immediately prior to the skull defect. The risk. A cranial fracture. The people at the risk are the fall which they them to the brain, boost the most vulnerable are not children and the elderly. Direct fracture. Direct fracture occur direct with for its applique. The risks in the same while the fracture are of direct impact, the people most and the risks are adult 6 months adult from for osteoporosis. Dislocation fracture. A dislocation is the complete separation of the bone, the make on the joint in subluxation. The bone of a joint are parting of place of time. A dislocation, a right discovered when the doctor puts him back in place. Reduction. But sometimes in dislocking of its own. Risk. This fracture or dislocation does not attract too much danger to the people with long tag in the broken muscle or this of reduction is done in remain normal. Double fracture. The fracture double fracture is the one in which the bone is fractured in two different places. The affected area vary usually and usually require some intervening to repair it. The risks, the people at risk and the adults because they have weak bone and other people is it patient in more and the break to bone so things can compromise arteries. The puncture fracture. The puncture fracture is an arch that usually for many tips and bending ankle fracture. The term is commonly used to refer to a fracture or the distal position of the femoral up and lateral manus when a section is up the tibial ligament and the ligament is lateral displacement of the status and position medial fracture is well. The risk. This fracture is the most risk for people who play sport to affect the with the they do sports. The very nice fracture. The bearing of the fracture and the type of pelvis fracture most commonly occur in the station of the direction belong to the ilium, uh, which as result associate ilium with fracture in the riga and the stable injury be made to operation on the event of severe communication. The rates, the fracture is more in danger the pregnant the woman, also the child might be in danger with broke bone also people of the egg. Thank you teacher, the present and the fractures.